So in this video, we will be discussing about immune thrombocytopenic purpura, that is ITP. It is an autoimmune condition which affects the platelets and only platelets. We will see only thrombocytopenia in ITP without any other clinical feature or without any other abnormality in the investigations. So as far as classification is concerned, we have divided ITP into two categories. One is primary and secondary. Primary means there is no associated condition and it is idiopathic, right? So it is always a diagnosis of exclusion. We have to exclude all other causes which can cause thrombocytopenia so that we come to a diagnosis of ITP, primary ITP. Secondary ITP is thrombocytopenia, isolated thrombocytopenia, which is associated with drugs or some underlying infections like HIV, HCV, HZV, or there can be some underlying connective tissue disorders like SLE, Apla syndrome, etc. Right? So in secondary ITP, there is isolated thrombocytopenia, but there is some underlying suspected cause, drugs, infection, or connective tissue disorders. So we will be discussing about the primary ITP in detail. As we have already discussed, primary ITP is a diagnosis of exclusion. We have to rule out secondary causes. Clinical features are like there is insidious onset of mucocutaneous bleeding. Female to male ratio is 3:1. Females are more prone. Investigations. CBC shows isolated thrombocytopenia. Very important point. Peripheral blood film shows large platelets, and bone marrow aspiration shows increased megakaryocytes. Cellularity is normal, right? Treatment. Our goal is to prevent bleeding, and risk factor for bleeding are extremely low platelet count, less than 10,000 per microliter. Personal history of bleed in the recent past, and age more than 60 years. First line of treatment is corticosteroids, IVIG, NTD, right? Patient may or may not respond to these first line treatments. Mostly patients do not respond to these treatments. We go on to second line treatment, which is like maintenance with romiloplastim, right? L-Trombopag or rituximab. L-Trombopag is thrombopoietin analog. I mean, it is some kind of stimulant, bone marrow stimulant to produce more platelets. Rituximab is anti-inflammatory. It is used in autoimmune conditions. It is antibody against CD20, B cell depleter, monoclonal antibody, rituximab. Splenectomy is very much successful in ITP. Response rate is 90%. Even though it is very much successful, it is very much effective, still first line of treatment is not splenectomy. It is always a reserved treatment. Initially we use corticosteroids, IVIG, NTD. If patient responds, second line treatment. If patient doesn't respond, splenectomy. So that is all about primary ITP or ITP as a whole. That is all. Thank you so much for your patient listening.